Welcome back to the Forge POV, where we cut through the noise to bring founders and the tech leaders the insights that truly move the needle. I am Subrata Kar. Today we are diving into a space where stakes couldn't be higher. Your life, your mother's, your neighbors. We're talking about AI, we are talking about healthcare, and we are asking the only question that truly matters. Can artificial intelligence fix the most broken system on earth? Now let's get real. Healthcare is a $4 trillion problem in the US alone. In India, it is over 6 lakhs crore rupees, close to $75 billion. In some regions, there is just one government doctor for every 10,000 patients. The system is outdated and chronically understaffed everywhere. And yet, AI is being held as the miracle drug, the universal fix. Or is it? Here is where the hype meets reality. Because on one hand, AI is flagging strokes faster than the radiologists, screening for breast cancers in the villages without hospitals, and turning messy, unstructured medical records into real-time clinical decisions. But here is the catch. Healthcare doesn't reward efficiency. In fact, hospitals often lose money when AI works too well. Less waste means lower revenue. Bureaucracy protects the status quo. Doctors are skeptical. Regulators are slow. So, what are we really dealing with? In the next 20 plus minutes, I will break down how AI is cutting through the sludge and where it is getting blocked. We will unpack the admin tsunami, why AI is saving doctors time, not lives yet. Diagnosis at scale, how startups like Cure AI and Niramai are doing more than any MRI machine ever could. Inclusions versus inequality. Will AI level the field or deepen the divide? Systemic friction where AI gets stuck, and why incentives matter more than innovation. And finally, my Forge POV, what founders really need to build and why it is not what most techs are chasing today. Links and case studies are in the episode notes if you want to dig deeper. For a deeper dive, check out my Spark Digest newsletter if you're building in healthcare or backing someone who is. Then this episode is your map. But first, let's talk about the part of medicine nobody signs up for. Paperwork, billing, insurance claims, endless admin. It is eating up doctors' time, patients' money, and maybe your next business opportunity. So let's start with admin tsunami. Let's start with something that doesn't get clicks, but quietly breaks healthcare every single day. Paperwork, billing, documentations. You see, it is not as glamorous as robot-assisted surgery or AI spotting tumors. But this is the bottleneck where highly trained doctors get buried in forms instead of saving lives. In the US, doctors now spend nearly twice as much time on documentation as on patients, and it is expensive, close to $1 trillion or 40% of all hospital costs go to administrative overhead. In India, though, the crisis looks different. Yes, on paper, the doctor to patient ratio meets WHO's 1:1,000 benchmark, but only if you count Ayush practitioners trained in Ayurveda, yoga, Unani, Siddha, homeopathy. On the ground, especially in rural districts, it is close to one doctor per 3,333 people, and in some cases, it is 1:11,000. So whether it is too much admin in the US or too few doctors in India, the result is the same. which is less time with patients, slower care, worse outcomes. And that's where AI quietly steps in, not to replace doctors, but to protect their time. Let me break this down for you. What Coda Metrics in the US is helping to achieve. Medical coding used to mean entire team of people assigning billing codes line by line. Now, Codametrics uses AI to scan clinical notes, assign those codes automatically in real time. It is not flashy, but it frees up hours a day. And that's a real impact. And then there is Akasa in the US. You know how messy hospital billing is? Slow, full of errors, totally dependent on humans. So Akasa built an AI engine to clean that up. It automates claims, billing workflows, even prior authorizations. Hospitals are using it already and saving millions in overhead. Now flip to India. Take HealthPlix. And what do? HealthPlix gives over 12,000 doctors a kind of digital assistant that fits how they actually work. Their prescription habits, diagnosis styles, patient notes, 14 plus local languages, even on spotty Wi Fi. Basically, every smartphone becomes a smart clinic. Think about it. And then there is Arogya AI in India. It uses machine learning to predict drugs resistance and automate diagnostics, which matters even when doctors are few and labs are even fewer. And finally, Abridge in the US. Abridge, founded by cardiologist Dr. Shiv Rao, uses ambient AI to listen, summarize, and auto generate clinical notes real time. At Corewell Health, this has already reduced clinician burnout by 53%, and 85% of the doctors reporting higher job satisfaction, and 90% saying they now give patients more undivided attention. Now, here is the big idea. All of these tools, they have got one thing in common. They are not AI for the sake of AI. They are built to give doctors back their time. That's the resource we are scaling here. Even just 20% drop in admin burden, that's more patients in, fewer delays, more time for judgment. The one thing no machine can replace. Up next, we go from admin to diagnosis at scale, where startups are using AI to detect strokes, cancers, and more in clinics, in villages, and in places medicine has never reached before. Stay tuned. So, we have talked about saving doctors' time. Now, let's talk about saving lives. Because the real issue isn't just inefficiency. For millions, it is inaccessibility. Think about it. Over 70% of Indians live in rural areas, but most qualified doctors, they're in the cities. In remote districts, seeing a trained doctor isn't just rare, it's nearly impossible. So millions rely on informal or unqualified providers, not by choice, but because there is no one else. And that's how people die. Not because their illness was untreatable, but because the right person wasn't there to catch it in time. And this is where AI can step in, not to replace doctors, of course, but to reach where they can't, to spot what otherwise missed. Take AI Doc in the US, for example. They are using AI to scan images for things like strokes, brain bleeds, where every second matters. With FDA-cleared tools, AI doc analyzes scans in near real time and flags abnormalities, helping radiologists prioritize urgent cases. Now, just to be clear, AI like this doesn't, of course, treat patients or make decisions. It flags what matters. It speeds up the handoff. The doctor still leads. AI makes sure they don't miss what's critical. In India, the challenges are very different. Poor connectivity, cost barriers, cultural stigma. And that's where Cure AI comes in, QURE.ai. They built an AI that reads chest x-rays and flags potential tuberculosis cases. Now, this isn't theory. It is live, 250 plus sites, screened over 1.7 million people. At the Mahakumbh Mela 2025, which is world's biggest religious gathering, Cure system ran right on site. It screened every chest x-ray in real time, even offline, when internet was out. Out of those scans, over a third were flagged as abnormal, and 12% showed presumptive tuberculosis. So, in a country still losing over 400,000 people in a year to TB, that's not just reach, it's impact. Now, let's talk about breast cancer, the leading cause of cancer death in women worldwide. But here's the thing, it is treatable if caught early. So, what's the real challenge? Well, it is not just medical, it is also about access. It is fear, it is social barrier. And that is where Niramai comes in. They built a no touch, no radiation thermal imaging tool. Women can be screened privately with dignity, even at home. You see, AI isn't about spotting tumors faster than humans. It is about who gets that diagnosis at all, especially in countries where access to diagnostics is still very limited. It is almost non existent for millions. Now imagine this, a woman in rural India can get screened privately, safely, without stepping into hospital, and thanks to AI-driven thermal scan. So I reached out to Dr. Geeta Manjunath, founder and CEO of Niramai, who's pioneering this very approach to understand what drove this innovation and how it is scaling across India. And what will it take to go global? It's already reached over 250,000 women, not in shiny hospitals, but in the very communities that often gets ignored. Her mission? Well, to give every woman the power to detect disease early, without fear, without stigma, or cost standing in the way. Listen to what she says.
Breast cancer is a huge problem today in the world. 684,000 women die every year because of this disease, which means that is 2,000 lives every day. This is almost unnecessary because breast cancer is completely curable. Nobody needs to die of breast cancer. Most women wait till there is a symptom before they come to a hospital. By the time they feel the lump, it's already 2 centimeters, which is stage 2, 3, 4. Yeah. And so their lifespan after that gets affected. Their health span also gets affected quite a bit. How can we solve this? We can solve this using an affordable, accessible method of detecting breast cancer. This is what we thought 8 years ago and devised this new method of detecting breast cancer called thermalytics. At Niramai, we have developed this new method where we just measure the temperature variations on the chest and convert the temperature map to a cancer health report automatically using artificial intelligence over medical thermal images. With this, we have been able to detect very, very small lesions, as small as 4 millimeters. And most importantly, it's completely privacy aware. No one sees or touches the person during the test. We have a booth-like thing, like a kiosk, like a changing room, The lady enters, she goes into the room, closes all doors and curtains, and then removes her clothes. Not even a technician is inside. This kind of complete privacy makes the lady feel more comfortable, and many women feel very, very comfortable to actually take the test on a regular basis. Once she's inside, it takes about 10 minutes where we blow cool air for about 5 minutes and then like just take thermal maps of front, left, etc. And she comes out, her report will be ready. So we have really made breast screening affordable and of course portable. This can be set up in any village, any school, any college premises or a primary healthcare center or even a corporate office and of course in hospitals and diagnostic centers as well. We can do this at very, very low cost with just 100 rupees per test, especially when we are looking at triage screening.
You see, these aren't just clever apps. They are new front lines in healthcare. They prove that when AI is built for constraints and not for comfort, it scales not just faster, but further. And to every founder watching, this is what a real use case looks like. It is not about raising your Series A. It is about helping someone who's never seen a clinic catch a disease before it kills them. Incredible insights from Dr. Manjunath the world often overlooks. So when AI is private, accessible, and culturally tuned, it is not just life-saving, it is dignity-saving. And here is the tension. For every breakthrough, there is a risk. And AI could democratize healthcare, or it could deepen the divide. If these tools only reach the connected, the urban elites, then we are not solving the problem. We are automating inequality. In the next section, we tackle that uncomfortable question. Is AI in healthcare a force for inclusion or a machine that quietly leaves the vulnerable behind? Stay with me. You may wonder, if AI is so powerful, then why isn't it everywhere in the healthcare industry already? So here is the truth. It is not the technology that's lagging. Then what is it? Well, it is a system. Let me explain. You see, in the US, efficiency can be liability. You would think hospitals would love AI that saves time and money. But here is the twist. US healthcare runs on volume. More tests, more procedures, more billing. If your AI cuts waste, you are not a hero. You are a threat to the bottom line. I have seen startups run perfect pilots. Doctors loved it, outcomes improved, only to watch the deal die in the boardroom. Why? Because less waste means less revenue. The system isn't resisting better care. It is resisting business model that worked for decades. Some hospitals can actually lose millions of dollars when AI reduces unnecessary tests. And that's the paradox. Better care, worse business. In India, by the way, it is not the money. The issue isn't misaligned incentives. It is raw access. Some rural clinics have one doctor for every 10,000 patients. AI could be a multiplier if the basics are in place. But if the power cuts out, there is no internet, even the best algorithms just sit there. The real opportunity? Build AI that works offline, on basic mobile, and in the language people actually speak. You see, India isn't one market. It's 22 plus languages and dialects. So picture this: a doctor in Karnataka, a patient in Bengal. and your AI needs to bridge that conversation seamlessly. Startups like Servam AI are already working on this. But ask yourself, does your solution survive real world messiness or break the moment someone switches language? Telemedicine is the hot promise, but let's be clear, the winners won't just be a video call apps. They will be the ones who make care work in the last mile, where the roads are bad, internet is worse, patients can't afford delays. So startups like MFine are showing it's possible. The real play? Use AI to triage, translate, and support diagnosis. So care happens anywhere, in any language, even offline. So if you are startup thinking about an opportunity, here is the bottom line. You aren't weighed down by legacy systems. You can move fast. You can build for the gaps. You can solve for the last mile. So ask yourself, does your AI survive when the incentives are broken? Can it work where infrastructure is missing? Will it scale in the language and realities most founders ignore? Because the system isn't ready, and that's exactly why you should be. So, where does this leave us? What's the real opportunity for founders? And what's the future I see unfolding? And that's what I will break down my next Forge POV, where AI in healthcare is really headed and what it means for anyone bold enough to build for the gaps. Stay tuned. Now let's bring it all together. We started with a bold question. Can AI fix healthcare's $4 trillion problem? What we have uncovered is urgent and nuanced. Yes, there are real breakthrough AI tools freeing up doctors' time, diagnostic platform reaching rural India, telemedicine connecting patients who were once invisible to the system. But let's not kid ourselves. These are pressure points, not panaceas. The system is messy, massive, and deeply resistant to change. So here is my take. AI isn't going to fix healthcare overnight, but it is already exposing the cracks, surfacing invisible labor, burnout, bottlenecks, and scaling expertise to places that have been underserved for generations. It is forcing founders, doctors, policymakers to ask what's possible now that wasn't before. So, if you are a founder or a builder, here is the real opportunity. Don't try to solve healthcare. Instead, find the leverage points where AI can drive real, measurable change. And here is my framework for the biggest startup opportunities right now. Number one, invisible admin, visible impact. AI that eliminates paperwork and billing friction, freeing up doctors' time, improving care. Number two, diagnosis at the edge. Tools that bring specialist level diagnostics to the last mile offline in local languages on basic mobile. Three, trust, not just tech. Platforms that build trust by working with community health workers, respecting privacy, and integrating with local customs. Number four, Language as infrastructure. AI that breaks down language barrier in real time, making healthcare accessible to every patient. And number 5, AI-driven triage and remote care. Telemedicine that's more than a video call app, but AI-powered triage, diagnostics, and follow-up for the last mile. Big tickets? Well, build the gaps the system can't fill. So if your AI solves a problem nobody else will touch, and it scales across geographies and income levels, then you are not just building a company. You are changing the trajectory of healthcare. Now, I want to hear from you. What role should AI play in healthcare? What's the biggest barrier you see in tech, trust, or incentives? Drop your thoughts in the comments or post with hashtag ForgePOV. You can also write to me directly at subrata@subratacard.com. All details in the description below. Until next time, don't just build for scale, build for significance. Stay curious, stay grounded, keep forging forward, and bye for now.